Hi, my name is Dr. Cirecie West Olatunji, and I am a professor and director of the Center for Traumatic Stress Research at Xavier University of Louisiana. Today, I'd like to introduce you to 10 pediatric counseling interventions for young children, particularly those who've experienced trauma. Now, I came up with these 10 interventions primarily because I believe that there's an insufficient focus on the importance of culture when we work with young children. I think sometimes we think that young children don't express cultural values or behaviors, but in fact they do. Also, we work very closely with their parents or caregiver, and they also have cultural values and mores that need to be included. And so a lot of these interventions really rely on the family to be able to dictate to us what works or what feels good to them. And of course, we want that because then they'll comply. Second, I know that from being a faculty member and training graduate students, both at the master's and doctoral level, that we provide inadequate training related to children from birth to 5 years old. Now, a lot of times people think about play therapy, but most of play therapy is really for school-age children. And we don't really concentrate a lot on the developmental issues related to children from the time they're born to about the time they go to school. And this is particularly true for pre-verbal children. Third, I know that there's very minimal research in counseling young children and their mental health issues, and we don't really know about what evidence-based interventions are available to us. Now, my center concentrates on traumatic stress, and we also have a particular focus area looking at young children, pediatric counseling. So we're trying to contribute to this research and also promote research in this area by commissioning scholars to engage in research and to write about these areas. So let's get right into it. So the first one I'd like to talk about is the use of popsicle sticks. And popsicle sticks is very easy to do. It takes very minimum training to be able to do this. So it means that graduate students as well as early career people can begin to use this. It's easy for parents and caregivers to do because it doesn't cost a lot of money. Sure, you could, go to a school supply or art supply store and get the really well done, colorful popsicle sticks. But you also could just go out and get a popsicle. And I think kids would like that. And then you can just sanitize, clean and sanitize the popsicle stick and then just use it. It's great because in engaging in the activity, we get some bonding between the caregiver and the child. It's a lot of fun to be able to do it. And is also very client-centered. The child directs who's in the family and how they want that family member to look. It's also culture-centered because they get to choose what the people look like, and they're able to reflect their own values. The second is feeling faces. This is also one of my favorites. It's worked well with the clients that I've counseled. And what's interesting about this is that although there are a lot of ways in which we talk about feeling faces, this one has actual children who've been photographed. That's very different from perhaps cartoon drawings. So this is very exciting. And a lot of times children who are pre-verbal, they are able to point to faces that represent how they're feeling. So it's great in getting children to identify what they might be feeling associated with some of the problems that they have. The third is storytelling. What I like about this is not only are we talking about stories that parents tell children, but it's also children can tell stories, and they can do this very early in life. So this is pretty exciting and very entertaining. So this is a way in which we can develop rapport with our clients. It's also a way for us when we're dealing with maybe intense trauma, that we can laugh and have a little bit of fun. And so it's very healing in that sense. But children also tell us what's happening. when they tell their stories. So it's very informative as well. I think a lot of people think about puppets right away when they think about working with young children, but we're going to do a deeper dive into that. For example, we know that older children are more receptive to particular kinds of puppets, and younger children, like 2, are more receptive to other kinds of puppets. And I learned that, I think, the hard way in scaring some kids by using some puppets that have been recommended. So we need to understand working with puppets in a much more nuanced way by thinking about the developmental levels of the children. When we're often working with children who've experienced sexual assault, or at least there's an allegation of sexual assault, it's very important that we engage in interventions with them in which we use anatomically and culturally correct figurines. So one of the things that we need to understand is, what do children know about sexuality, and what is the meaning that they connect to different body parts? And so we're looking for reactions to that and for developmentally appropriate reactions. So by having these figurines, we're able to have children to talk and to respond, to ask questions, and also for us to do observations. So I look forward to talking to you about that. Number 6 is the dollhouse. I like this because it sort of broadens the lens a little to take a look at family dynamics and family behaviors. So we get to see a lot more about what's going on in the family. So not just maybe smaller interactions between perhaps one person and the child, we get to see a lot of interactions. So it's almost like a chorus or an orchestra when we're looking at children and their families. So we get to see a lot of behaviors. We can see patterns. We can look at things over time. We might even be able to take a look at ancillary members of the family who may not live in the house, but maybe they come to the house. So this is really good. We also get to see children's comfort level, for instance, about how comfortable are they in interacting, and where do they spend most of their time. So we'll talk a little bit about that. Marlene Clay, or sometimes people call this Play-Doh. So the idea is that not only are we getting an idea through creativity what the child wants to talk about or how they feel about something, they're also getting therapeutic value from the manipulative of actually having the clay in their hands. So this is very, very good for children. It is a form of mindfulness, really. So it's very healing. I really enjoy this. It does a lot of things at once. And it's also inexpensive. Number 8 is freehand drawing. And I think we all enjoy doing that, even as adults. We like to do freehand drawing. Working with children, I think it depends on your theoretical orientation, how you deal with the images that are there and what the meaning is for that. For me, I really like to stay client-centered. I really like to focus on what does the client say it is. So with that perspective, when we're working with very young children and their drawings may not be understandable or recognizable, it can look a lot like scribble. Then they tell me what it is. They point to certain things and they say what that is, and I mark the drawing and indicate what those items are identified as. And then we begin to work through on the narrative of what is it and what does it mean. Number 9 is draw a family. I don't think anybody doesn't like this particular activity. And I think, when I think about draw a family, I always think about one particular client that I had, a little 8-year-old boy who drew his family, and he drew his mom, then he drew his brother, his older brother, and then he flipped the page over and he drew his dad. And so I thought that was very amusing to see that even in drawing the picture, that the child was trying to tell me something about closeness and proximity, emotional closeness and so on. And in fact, I learned a lot about the family dynamics just in observing this child to draw the family. So this is always a hit, regardless of your theoretical orientation. But it is something that we can use with children who are before they get to school, who are younger than 5. And lastly, in vivo. So live observation and feedback can be extremely helpful to the caretaker and child. What I like is that not only can we provide feedback about what they could do differently to be able to work with their children and to support their development, we can also tell them what they're doing well. And I think we sometimes forget about that we can help with strength-based interventions to be able to tell parents that maybe intuitively they're doing the right thing. This is good because it's sustainable, so that means they can continue to do it and be very intentional about the interventions that they're doing in their parenting. But it also means that they can make recommendations to people they know. So that means you don't even need to be called for the next person. Sometimes they can just provide their recommendations and advice that is evidence-based, that comes from a professional. So I like the fact that there's this ripple effect when I help parents to understand what they're doing well, that they can continue to tell other people in their system. So I hope that you'll join me on this journey of learning about these 10 pediatric interventions. If you'd like to contact me, you can email me, you can telephone me, you can go to our website. There are other resources there. And of course, on social media, you can contact us through Twitter or Instagram. And we look forward to hearing from you. And I look forward to you joining us for the very first intervention. Thank you. I thank the Digital Studio staff and Faculty Resource Network staff at New York University for their support for this project. Bye.